Hello, everybody. This is Dr. Kashif Abdullah. This is my ongoing series regarding drug-free treatments of insomnia. And previously, we discussed sleep hygiene, and this video will focus on stimulus control therapy. So, I'd like to start again by discussing the three P's. That's your predisposition, precipitating events, and perpetuating events. Predisposition, everyone just has by nature. A precipitating event is something like a trauma of some sort, maybe job loss or the family loss or what have you. If you'll notice on the chart, you'll notice that the predisposition falls to usually about below the insomnia threshold. But it's the perpetuating um, conditions or issues that continue with the insomnia. So it's the perpetuation that we want to stop. We want to break this perpetuating and its habits really, and its these perpetuating factors we want to mitigate by the treatments that we give. So one of the first things you should do is create a sleep log. I will provide a link below. And the reason a sleep log is important is because it allows physicians and the patient and yourself to determine when you're having insomnia, when you're sleeping, or what have you. What is the nature of your sleep? It gives a more complete picture. The diary gives instructions on the top. It's very simple to use, and it's something that is evidence-based in its efficacy. So, treatments. Insomnia has two treatments. This series is basically about the drug-free or the cognitive behavioral therapy. There is, of course, the other arm of insomnia, and that's medication. This is something you have to go to your doctor for. Now, insomnia usually requires both arms. You need both sometimes you need both medications and the cognitive behavioral therapy that we're discussing right now. So just doing the cognitive behavioral therapy or just doing these drug-free treatments might not be enough. You might need that medication to get over the insomnia. So but let's continue on with stimulus control therapy. So I've already discussed sleep hygiene before. Sleep stimulus control therapy I'll be discussing, and later on sleep restriction therapy, relaxation therapy, and cognitive therapy. And these are all under the subheading, are all under the heading of cognitive behavioral therapy. So one of the things you have to do, or many people suffer when they suffer from insomnia, is they're associating their bed with stress, anxiety. They do not see their bed as a place of rest. They see this place, oh, I gotta get in that bed, and they're just not gonna sleep, and it just becomes a stressful event just going into your bed. So, what we're trying to do is we're trying to break that association. So, you might notice that if you're on the couch, you might just go to sleep instantaneously. You're watching that TV, you're using the internet or whatever, and you just go to sleep just like that. And it's not your bed, and sometimes you may be able to sleep in other places that are just, you'll notice, that are not your bed. For whatever reason, you can sleep here, but you can't sleep on that bed. So we have to break this association. We have to break the association that is a place of rest of stress, and we have to reassociate the bed as a place of rest. And that's what stimulus control therapy is trying to do. And quite honestly, that's what cognitive behavioral therapy is trying to do for insomnia. We're trying to break that association. So we want to reassociate the bed with sleepiness instead of arousal. So the first thing is you go to bed when you're sleepy. You're not sleepy, don't go to bed. You trying to break that. Do you go to your bed when do you go to your couch when you're stressed or what have you? Usually you go somewhere relaxing. So don't go to when you're not sleepy, don't go to bed. So, and your bed is only there for sleeping and sexual activity. You're not reading, you're not watching TV, you're not eating, you're not working in bed. Your bed is only for sleeping. You got to break that association of bed being something else. It's just there for sleep. If you're unable to sleep in 10 to 15 minutes, get out of bed. Don't stay in bed. Get out, do something relaxing. Read a book, cook, um, do something else. When you feel sleepy, then go back to bed. And if you're back in bed and you're not sleepy again, get out again. Don't get out of bed. Just don't make bed a tense area. Just get out of bed. And once you do wake up, immediately get out of that bed. Your bed is not there as a breakfast table or a desk to do your work now that you're up or to check your emails. Nope. You woke up, it's time to get out of that bed. You're making that bed only there for sleep and sleep alone. And also try to refrain from daytime napping. So you're trying to save up yourself for that bed just for sleep. So, um, the next series we'll be discussing is sleep restriction therapy. And I'll see you then. Thank you. Bye bye.